Hi, my name is Dr. Peter Merkel, and I'm a rheumatologist at the University of Pennsylvania in Philadelphia, United States, and a long-standing member of the OMERACT community. And I'm here to give you a quick introduction to ANCA-Associated vasculitis and get you ready to attend the OMERACT 2020 Vasculitis Workshop on Monday, December 7th. What is vasculitis? Well, it's any one of a spectrum of relatively rare diseases involving inflammation, leaking, or destruction of blood vessels with resulting damage of the tissues, organs supplied by the affected vessels. Vasculitis can involve virtually every organ system, although each syndrome has its unique aspects. Some key points about vasculitis to know. These are mostly rare diseases with frequent delays in diagnosis. Vasculitis is often life or organ threatening. Treatment for vasculitis is often aggressive with immunosuppressive drugs that lower the immune system as glucocorticoids or steroids, but it can be quite effective. The cumulative burden of disease on patients is high from both the disease and the treatment. Relapse on vasculitis is unfortunately quite common. This is a list of many of the different forms of vasculitis, and what we're studying today is ANCA-Associated vasculitis, in particular microscopic polyangiitis and granulomatosis polyangiitis. Long, complicated names, but I'm just going to talk about ANCA-Associated vasculitis to capture all of these. ANCA-Associated vasculitis, or AAV, involves many different organ systems. There's a lot of disease in the upper airway, in the nose, and the sinuses, and the ears. There's disease in the lungs all over the place. The kidneys can be involved, causing something called glomerulonephritis, which is quite bad and can lead to kidney failure. There's a lot of neurologic disease. There is joint pain or arthralgias and arthritis and fatigue. There's inflammation of the eyes. There's skin disease. There's vascular disease leading to gangrene and clots, blood clots, occasional cardiac and GI disease, and lots of laboratory changes, and even other problems not listed. I will very quickly go through a series of slides to show you some pictures of the disease as how it manifests for patients. This patient had a lot of sinus disease. She had this whole area is all clogged up with inflammation. It should be clear like this. And she actually had lacrimal gland involvement so that she couldn't, her tears would not drain into the lacrimal glands and she would have tearing. This woman had very destructive nasal disease resulting in a deformity. This can be corrected with surgery, but it is obviously a big problem. These are different patients with different forms of hearing loss you can see in this disease, where lowering of these curves is bad, and this is various forms of hearing loss that can be very devastating for patients. These are lung nodules. That's a nodule, that's a nodule, that's a nodule. There are lots of these lung nodules that can happen. It can be problematic. This is what it looks like on CAT scan. You can see these are pretty big nodules. They often disappear or at least get smaller, but not always all the way. This patient has a lot of cloudiness and it should be black, and that's because this patient is a lung full of blood. This is called alveolar hemorrhage. This can kill patients and it's very serious. This is what it looks like on CAT scan sometimes. You can see all this white stuff filling in the lung. It should be black like that. This can either respond very quickly or it goes badly. This is interstitial lung disease or fibrosis in the lungs. This is a different process that's increasingly recognized, but also part of ANCA-associated vasculitis and also part of other rheumatic diseases. This is a kidney biopsy, and you can see under the microscope. If you don't know much about kidneys, I can tell you this is bad. This is what leads to kidney failure. This is a person who is unable to lift his or her hand up because of neurologic damage. This can be really disabling for patients, and it can happen in vasculitis. This is inflammation in the eye, which can cause visual loss and change if not treated quickly. These are ulcers in the mouth. These are nodules on the skin, which can be annoying. This is bad. This is gangrene. This is on the left side is an angiogram putting dye into the blood vessels. Usually you see a lot of blood like this, but in the top of the foot here, you see very little blood flow, and that's what's leading to gangrene of the toe for this patient. So what are the basic principles of treatment of vasculitis? Well, it's a disease of the immune system causing inflammation. So we want to reduce the inflammation for a short-term quick benefit, but we also want to suppress the immune system for a longer-term benefit. And we want to, of course, save the patient's life, but also prevent permanent damage to tissues and organs, prevent treatment-related toxicity, which can be a real problem, preserve and improve the quality of life, and prevent relapses, which are common. All of these goals of treatment may not always align, and we have to carefully balance this. We want to avoid undertreatment and overtreatment, which is a problem in this disease. Many patients, by the way, do quite well and go on to have excellent lives. I don't want you to think it's always bad. We have much better treatment than we had 20 years ago, but we can do even better. And that's the goal of our research. This is some algorithms of how to treat either non-severe or severe disease. And you will notice that there are several different types of drugs. If you are familiar with some of our other rheumatic diseases, either as a clinician or as a patient, you'll recognize many of these drugs. They're used in other diseases. We use them in vasculitis as well. What you can see is we have a variety of choices. That's good, but it means we need to measure what's better and worse across these different drugs, and that requires proper trials and good measurement. We do have an OMERACT Core Set for what to measure, what domains to measure, and what instruments to use in ANCA-Associated vasculitis. This was actually endorsed heavily by OMERACT some years ago. However, are we really capturing all the domains of illness when we measure response? And I'm not so sure at this point. I think we could do better. This is our major instrument that we've been using, which is called the BVAS in various versions. It's really a checklist of different problems that can happen in vasculitis and whether they're present or not. And what you can see here is you tick individual items, and then those individual items have different weights that add up. This has been a major advance to use BVAS. Absolutely. The use of BVAS has definitely helped advance the conduct of randomized controlled trials in ANCA-associated vasculitis. It has led to regulatory approval of drugs in vasculitis, and it is widely accepted by clinicians and the worldwide vasculitis community and drug companies and regulators. However, there's some challenges to it. It's essentially a dichotomous outcome of active disease. You either have active disease where your BVAS is positive, greater than 0, or you're in remission where your BVAS is 0. There's really not a lot in between that helps us to sort out different drug effects or other treatments. The score is not really linear. So a score of 12 doesn't mean that someone is 3 times worse than someone with a score of 4. And there's no easy way to capture partial response. We've gotten to the point where we now need to be able to capture partial response and early response in this disease to sort out our drugs and look at what's effective. So the goal of the ANCA-Associated Vasculitis Response Criteria Project is to develop an outcome measurement system that captures the full scope of the burden of illness along with multiple domains and allows for detecting clinically important responses to treatment across a wide spectrum of disease activity. What are the next steps for you as an attendee? Well, you should read the late summary, which is only 1 page. You should view the OMERACT Introduction to Composite Outcomes, which is very interesting. It will help you set up for the whole concept of composite outcomes. You should view Dr. Thomas's Introduction to the Project, which is also very helpful. Both of these videos are fairly short. All of these materials are available on the OMERACT website. And then, of course, you should show up and attend at one of our workshops, either in the morning or afternoon, US time, on Monday, December 7th. So I look forward to seeing you there. Thank you for your attention.